What's up, YouTube? I wanted to do a quick video, 20-day post-op ALIF surgery, lumbar fusion revision, and just wanted to give an update on the pain, issues, things like that. Um, Everything was great at the hospital. The surgery went well. I was off, didn't have to use a morphine pump, didn't have to use muscle relaxers, nothing. The only thing that they were giving me through the IV was Tylenol. The pain wasn't that bad. The incision in the front probably hurt the most. Went home the next day, again, taking extra strength Tylenol, 2 of them every 6 hours. And then about the 12th day, I got really bad sciatic pain down the right side. Couldn't sleep. Um, Probably 2 nights, I slept maybe 30 minutes to an hour. And then called the surgeon. They told me to take the muscle relaxers, the oxycodone with Tylenol, gabapentin. So I started taking that. I was able to sleep maybe 3 or 4 hours. Next night, I tried to take the oxycodone. I took a half. It didn't do anything. So I took another half, and then it didn't really do anything. And then about 6 hours later, I took another one, the whole tablet, and a muscle relaxer. And again, I was able to sleep maybe 4 hours. I called the physician's assistant who worked with the surgeon, asked if they could give me a Medrol pack, which is a steroid pack. And the next day, I took like the 5 tablets throughout the day. Sciatic pain went from a 9 to a 1. I was worried when I got through with that pack that it might come back. And knock on wood, it's been 3 or 4 days since since I finished. Hasn't come back. So that's good. I've been trying to walk a little bit, but I'm getting a lot of pain in my lower left side of my abs to the left of the incision. When I walk more than a quarter mile, it almost feels like what you would imagine a hernia feels like, pulling, burning, to the point that I have to stop walking. It's strange, really. So, I've talked to the surgeon. I actually called the PA yesterday. She's supposed to call me back. She's going to call the surgeon who did the back surgery, but they also had a stomach surgeon who did the incision, moved everything over so that the surgeon could get in there and do the fusion. Then they move it back, and then he sews it up. So there's 2 surgeons working at the hospital. What I've been doing instead of trying to walk a mile is about every couple of hours, I walk a quarter mile before that pain really starts pulling and hurting. This weekend, I went furniture shopping, my wife, and could barely get through the store. Tried to go to Costco later. It's always worse during the day. When I wake up, doesn't feel too bad. So I'm trying to see how doing the quarter miles works. So far, it's yesterday. It went pretty well. And today I've done it twice. So I'm at a half a mile. 1 o'clock, I'm going to do it again, and then probably one later. And just hopefully by tomorrow, it's not still hurting. I'm still using the bone stimulator. Haven't used the back brace at all. Didn't use a walker. Like I said, out of surgery, man, I thought this is nothing compared to even the last surgery where they went in from the back. Um, but, I'm just hoping the sciatic pain doesn't come back. Told the physician's assistant that part of the reason I didn't notice the front lower pain as much, one, I thought that was just normal from the incision, with all the nerves connected to the side and everything, which she said it might be. And the other was that my leg was hurting so bad that the other pain was, nothing compared to that. So that's my 20-day update. I actually go on the 23rd of May for my 2-week post-op with the surgeon. The scar is healing pretty well. It's about a 6 or 7 inch scar from your belly button down. The physician's assistant said I could probably get in the hot tub after another week. My wife wants me to wait until the surgeon actually says, yeah, you're good to go. Can't wait to take that first bath. When I got home from the hospital, they had a gauze bandage down the incision with a clear piece of plastic looking tape. You could tell they used some kind of super glue over the incision, but I was able to take a shower with my back facing the shower head. Also got a sprayer, which I'd recommend if you're having spinal surgery. Again, I might have mentioned this. I got the riser on the toilet with the handles from Walgreens. It was like $75, $80, but that's been pretty huge at night. I've been drinking a ton of water just to see if that does anything. Not really sure where the sciatic pain came from. It's kind of weird. It hit me on that 12th day when everything was going so well. But that's a 20-day update. If you ask me right now, if I could go back the day of surgery and not have it, as opposed to now, I would probably lean towards not having the revision surgery. But the only thing I do notice now is my back's not hurting like it was. But again, I think in a couple of months, I'll be able to tell if it fused and if that same back pain I was getting before comes back. That if it does, then I wasted probably a year of my life and being miserable for 2 weeks for this. But what I'm hoping is everything heals up, the incision, all the pain in the front, and then I can get back to walking the mountain or doing what I was doing before. And then at that point, I still feel like a year or two from now, I'm going to be looking at a fusion or some kind of disc cleanup at L5-S1. Mine was L4-L5, just because that's where that sciatic pain was coming in on the back of my leg, side of the leg, which tells me that's the lower disc. And there shouldn't be any disc left in L4-L5, so everything I assume is coming from L5-S1. But crossing my fingers that maybe just taking it easy for a while, letting everything heal, let the nerves calm down, that maybe I won't have to do another surgery, because my biggest fear now is that sciatic pain coming back, or this being a hernia that was caused from the incision or something being moved around. Then my goal right now is to never have to have another surgery. If you ask me to go back to the first discectomy I had when I first ruptured the disc, the only difference I probably would have done is I probably would have gone to somebody that does this minimally invasive thing where they come in from the side with this, they put in this blue dye and they clean out the disc. They don't go through your back. There's a guy in Florida and there's a guy in California that I've seen doing this surgery. And I think I've found a guy in Atlanta that might do it. I would probably go to one of those guys and have them try it. And then when I ruptured it after the discectomy, the first time, I would have done another discectomy, or again, gone to one of these guys instead of opting for the fusion right away. Like I said, when they did that fusion, they put in a little spacer, which I would never do that again either. All that did was dig into the bone, and I think that caused a lot of the problems. My back didn't fuse, and that's why we're at the revision. But again, I don't do this to make money, just trying to help anybody that's suffering back pain. I've talked to so many surgeons in the last, since 2017. And, I'd probably do things differently than I did. But I felt like this was the next step in trying to be pain-free, having the revision. Again, I'm not a medical doctor, but if you want some advice or tips, tricks, Shoot me some comments and I'll answer any questions you have. That's it. Thanks for watching.